Welcome to Small Business Saturdays video series with your host and my husband.
And my dad, Aaron Montgomery.
Join the conversation.
Let's talk some business.
Good morning, good morning, good morning. Welcome in to a really special edition of Small Business Saturday here today. We're going to be talking with an expert in the insurance industry when it comes to health insurance here today. I've got a guest that I was fortunate enough to find through a business owner dads group, a Facebook group that I'm in, and really excited to talk to Scott. I just had a moment to talk to him briefly before we got started, and fantastic gentleman. So I'm looking forward to this. Let's see who's checking in here this morning. And all right. So, and I know when we're in the groups here, the Facebook likes to hide people's identity. So if you'll do me a favor, good morning, by the way, if you'll do me a favor and head over to oursuccess.group/Facebook, that'll automatically give StreamYard an opportunity to see who it is that we're talking to here this morning. So hopefully that will get you where you need to go. But again, talking about health insurance this morning, love to have your guys' participation, feedback, questions, and just you want to make sure that we get all those things covered. I know for a small business owner, getting into business, going from that, okay, I've got a day job, to, okay, now this is a side hustle, to, okay, this is full time. That is one of the big challenges that I think we face, because in a lot of, and I've heard this, you guys have told me this, that this hurdle to have that health insurance that is required, and then also it gives us the protection that we need, and also is something that we can afford as a small business owner. So we'll obviously leave all that to Scott here in just a moment. Real quick thing that I wanted to share with everybody is just make sure that if you are interested in the Masters of Success Mastermind program, we are accepting applications. Another about 11 days here left. So at the end of March, we will close up the application process, and we will get the next round of Masters of Success Mastermind groups together, and those will start happening in April. So we want to get the best groups together so they get the best value out of their time together. And so far, the Masters of Success groups have been nothing short of amazing, and I think just really helpful for everybody involved. So if you have any questions about that, please feel free to reach out. We're happy to get together with you on a call. Even have some folks that are currently in the Masters of Success that would be happy to talk to you and just share what it is that they are getting out of it, and the value that it brings to them and their business. So that's my quick pitch for this morning. Again, if you'll go to oursuccessgroup.com/MOS, let's see if I got a banner here for that. There we go. If you'll go over to that link right there, oursuccessgroup.com/MOS, that'll give you all the information. That's where you can apply to be part of the program. It's got the pricing at the bottom. If you scroll even further down, there's even a link down there that you can just click and set up a Zoom call with us so we can answer any questions that you have and just see if it's the right fit for you. So, all right. So without further ado, I want to welcome my guest in here. Scott has been an insurance broker for over 35 years, specializing in employee benefits, which include health, dental, vision, life, and voluntary supplemental products. He's worked with small to mid-sized companies along with individuals and Medicare. He's managed sales teams at Anthem Blue Cross, managed the group benefits operations at the Daniel Henry Company, and for the past 16 years has had his own insurance agency, Stream Benefits Group. 2 years ago, he merged with an agency, DeWitt Insurance Agency, in order to have greater access to all the various programs and products. So without further ado, Scott, welcome into the program.
Good morning, Aaron. How are you doing today?
I am doing fantastic. Thank you so much for getting up early on a Saturday morning. I know, it's one of those things where Saturday, hold on a second, but right. I appreciate you being here.
Oh, good. Thank you.
Yeah. Great. So Scott, read a little bit about your background there. You mentioned that you work with, small to mid-size businesses. So right. 16 years in your own agency. What do you find with those small businesses you see in thinking about from the vantage point of a small business, or maybe even a solopreneur type? What do you see are their biggest challenges when it comes to finding the right health insurance program?
Well, there are a lot of issues out there facing the small business owner or the entrepreneur as far as how do I handle this? Where do I go to find the right program, right product? Probably the biggest issue that a lot of these individuals have is what's it going to cost me? And so there's various ways in which the small business owner can go as far as finding the right program for them. In the St. Louis area, there are small business products, as well as if you're an individual and you just want to get an individual program, there are individual products. So, but the biggest challenge is what's the right one for me, for my employees? How much is it going to cost? How much is it going to cost me? How much is it going to cost the employees?
Yeah.
What are the doctors that are going to be involved within this network? Can I go to any place I want to? But the biggest challenge I see facing these individuals and these small business owners is what's the cost? This is a big issue for many small business owners, because in many cases the group health insurance program that they put in place is if not the biggest expense they have, it's second or third, right behind maybe rent or some other issue and everything. So it's a big expense. And they want to make sure they're handling it properly and got the right program in place for their employees. And everybody's is a little bit different. It's not a situation where there's a specific template that's going to work for every single business owner.
Yeah.
They got to look at the different things and find out what's best for me. It could be based on their industry. Are they in an industry where it's imperative that they have a group health offering for their employees in order to attract and retain good employees? Some businesses, it may not be as necessary as it is in other businesses. In some businesses, they just want to offer maybe a catastrophic type of plan. In another business, it says, you know what, we really need to have something that has a first dollar coverage, something that's much more extensive for their program, not only for the employee, but for their family as well. So you have to take all those things into consideration when you're looking into what's the best fit to help them meet their challenges.
Sure. And Scott, you kind of mentioned there, in the St. Louis area, there's different products. Is this going to vary from, city to city, state to state? I mean, is that a challenge okay?
That's a great point, because insurances are basically state-run programs. So not only is it different from one state to the next, and in the St. Louis area, it's different from St. Louis to, let's say, Belleville. What we have over there in Belleville or Alton or, whatever, because they've got the state of Illinois programs, we've got the state of Missouri programs, the insurance is different, the insurance carriers are different, the products are different, the way in which they are rated may be a little different. And so you have to take a look at that as well. So when I'm referring to the St. Louis metro area, it's basically from the Mississippi West in these surrounding counties and everything. But I also work with employers that are located, in the greater, on the east side and everything, and Alton and Belleville and on all those areas there as well. But there are differences, yes.
Yeah, definitely. Okay, so Scott, now, like in a situation that you're in, how would you, could you work with people outside of the state of Missouri, outside of Illinois? I mean, do you have to kind of be licensed for each kind of state? Is that how that works?
You have to be licensed in each state. That's another good point, Aaron. And I'm licensed specifically in Missouri and Illinois. There are some insurance agents that are licensed in every single state. That's a rarity. Usually you're maybe in a couple of states that you're licensed in. One of the nice things that I have, though, through my relationship with the DeWitt Insurance Agency and the National Association of Health Underwriters, is that I have access to insurance agents and brokers throughout the United States. So if I'm not able to work with somebody, let's say in San Antonio, Texas, I can get a one or two agents in that area to help somebody who is domiciled there in the San Antonio area or wherever it may be in the United States. So it's really nice. So though personally I may not be able to assist, I can put them in contact with somebody who's a professional insurance agent.
That's awesome. That's awesome. I knew we got the right guy here, Scott. So awesome. So a couple of little things that you and I kind of talked about before the program, not today, but just through our email exchanges that we had there. But I guess talk to us as if we're like super beginners, the basics. But tell us a little bit about what ACA is
Yeah.
and the marketplace, and what was that designed to do, and who is that for?
Sure. Well, the ACA is the Affordable Care Act. It actually was signed into law. It's been 11 years now, March 23rd, 2010. So it's been
Wow.
11 years that it's been up and going. And there's been different components of it. And some components have changed multiple times. Some have stayed the course the entire time. It basically was put in place to try to assist individuals and small businesses, helping them with their health insurance programs and cost. Okay. It is a vehicle by which the federal government is able to provide some assistance for those costs and to provide access to various programs.
Gotcha.
There are really two different parts of it. The piece we want to talk about right here is what's to do for small businesses and what's to do it for individuals, and two different worlds. The small business piece was, when it came out, was called SHOP, which is for just small business owners health insurance program. Quite frankly, in the St. Louis area, it really has not taken off that well, or as well as they had hoped for, because one of the issues is you've got to get insurance carriers to participate. And if those insurance carriers are not participating, then it's really a moot point. And quite frankly, we only had one insurance carrier from the get-go initially participate, and the program really did not take off too well. So that SHOP program through the ACA in the St. Louis area really has not taken off as well as maybe the federal government had hoped for.
Yeah.
The individual mandate, which is the individual marketplace, it goes by different names. You're going to hear the name healthcare.gov, the marketplace, Obamacare. You're going to hear those terms. They're all kind of tied together. It's all the same thing. Healthcare.gov is in essence the vehicle by which an individual can go online and find out if they're eligible for some assistance for their individual plan. So let's talk about individual plans, because that's an area that has gone back and forth and everything in between.
Yeah.
Prior to the Affordable Care Act, you had a number of different insurance carriers that were offering insurance programs to individuals in the San Luis area. And all of these insurance programs were, well, number one, they were not guarantee issue. What's that mean? Well, it means that the insurance carrier can decide who they want to insure and how much they want to charge to insure that individual. Okay. And so what happened is there were a lot of individuals that were being turned away for pre-existing conditions. That was probably one of the major thrusts of the ACA initially coming into play, is that you had individuals who were being turned away for health insurance because of their pre-existing condition. And that was done by all the different insurance carriers. So it wasn't just Anthem Blue Cross or United Healthcare or Covenant or whomever. That's the way it was just set up. So the ACA said you can't do that anymore. You have to accept everybody, and you have to play by specific rules. Some of those rules are what they call the essential health benefits. There are 10 essential health benefits that every insurance carrier had to offer in these individual plans. Things as you have to provide prescription coverage. You had to provide maternity coverage. You had to provide pediatric dental and vision coverage. You had to provide hospitalization, so on and so forth. Okay. So you had these 10 essential health benefits. So what happened is a number of the insurance carriers said, thanks, but no thanks. We're not offering it. We're not getting in that market. We're leaving it. We're not doing it. And it depends on the certain region, not only in the state, but also within the state. Yeah. You've got a couple of insurance carriers that were doing it for the San Luis area for a while. You had some that were outstate. There are some parts of the United States where there's only one insurance carrier offering an ACA compliant plan. And that then kind of makes it very interesting over the last 10 years, because it's like, well, I don't have any choice. This is my only insurance carrier to go to. But there were certain rules that they do have to abide by as far as what they can charge and so on and so forth. So it's through the marketplace, healthcare.gov, that an individual will then go, if they want to purchase a plan, and they can get some assistance. And the assistance is all based on their income, their projected income for the upcoming year. So if an individual is making less than $50,000 a year, they're going to get some assistance. It's a sliding scale assistance that they're going to get to help them offset the cost of that individual premium. So, and it goes up depending if you're married or have kids, et cetera, et cetera. So that's what the ACA and the marketplace component of it was meant to do. Is just to provide guaranteed issue programs and to give them an individual and potential assistance. Quite frankly, there are a number of individuals who do not receive any type of assistance when it comes to these. And when I say it's assistance, it's a tax credit, it's a subsidy. It's basically they're reducing your gross premium down to a net premium number each month.
Gotcha. Okay.
Long-winded discussion about it, but I mean, you could talk for hours about that program. You really can. It is very complex, but it's like, again, everybody's different as far as where they fit into that program and what's the right insurance carrier for me. In St. Louis now, we've got 4 insurance carriers that provide individual programs. But the key thing about those things, Aaron, is that each insurance carrier, and they've all got about a half dozen to a dozen plan designs, but they've all got different networks. And when I say networks, I'm talking about provider networks, hospitals and doctors. So they're defined networks. So the key thing with selecting your individual insurance program is to make sure that your doctor, if you have a doctor, your primary care physician is in that specific network. Because if he or she is not, you're out of luck, and you're out of luck for the whole year, because you can't just keep changing back and forth your insurance plans during the course of the year. Once you're in for that year. So it's imperative that you make sure that you got the right insurance carrier, and then you select the right plan moving forward.
Yeah, that's a wonderful tip, Scott. Thank you for sharing that. Yeah, I guess it's certainly not something I would have thought about. It's like, okay, you get your insurance and then you go, oh, well, the doctor I want isn't in this plan. And you're like, okay, well, let's just change it. But if you can't, then
it's really scary, quite frankly, because I've had so many people call and say, hey, Scott, I'm in this one program, one insurance carrier, and now I found out my doctor's not in it. What can I do? I said, well, you got to make sure you find a doctor in that network, because what happens is these programs, what they call EPOs, exclusive provider organizations, which means there's only in-network benefits. There is no out-of-network, which is what a PPO offers you, preferred provider organization, where you have in and out-of-network benefits. And EPO says if you don't use that doctor, you have no benefits. You have zero. And so you got to make sure that's why it's so imperative to find the right insurance carrier with the right network for that particular person. Yeah.
So Scott, help us with this then. What are the things that, a small business owner, an individual, people that are, again, looking, when I go and I want to kind of navigate the marketplace, what should I be looking for? What should I be, so you told us about making sure your doctor's in network. Are there other tips that you can share?
Well, the right doctor, and also then the plan design, because you have a wide variety of plans. The plans are all given metal names: gold, silver, bronze. The better the plan, the better the metal, the better the plan, the more expensive the plan. So your gold plans are your most expensive, down to your bronze plans, which bronze plans are in essence considered catastrophic plans, high deductible, not a whole lot of bells and whistles before you get to that high deductible program. Yeah. One of the other key things that I think has really come out of all of this is that the individual needs to be taking a look at what their maximum out-of-pocket number is. Because quite frankly, in so many of these plans, it's the same number or close to the same number. And it could be somewhere around $8,000, $9,000 a year for that individual. So it doesn't matter if you've got a $2,500 deductible, your out-of-pocket maximum may be $8,000. What's that mean?
Yeah.
Well, what your out-of-pocket maximum means is, what's your worst case scenario? After your deductible, your co-insurance, your co-pays, all your costs that you had throughout the course of the year for prescriptions, office visits, emergency room, that all goes for your maximum out-of-pocket. So what a lot of people tend to do is go with a higher deductible if their maximum out-of-pocket is going to be the same even with the lower deductible, because that higher deductible plan is going to have a lower monthly premium. Does that make sense?
It does. So
again, everybody's a little bit different though, because I've got somebody who says, listen, I use the doctor every week and everything. I need to go. Well, then you probably need to have that gold plan, which gives you more benefits, because you're going to pay more for it each month, but overall your exposure is going to be better than maybe just one of the other programs. So everybody's a little bit different.
Yeah.
I would strongly encourage anybody who is going to be taking a look and going out on the marketplace, going out to healthcare.gov. In the state of Missouri, there's 37 states that use healthcare.gov. Okay. Not every state uses healthcare.gov. That's the federal marketplace.
Gotcha.
All right. There are some states that you have their own. Missouri utilizes healthcare.gov. Illinois has their own. They don't use a healthcare.gov. Okay.
Gotcha.
And healthcare.gov, I would strongly encourage anybody who's thinking, okay, I need to get an individual plan and everything, to contact an agent, contact somebody who's had some experience dealing with it, because it can be very, very confusing to try to navigate. They're going to ask you a lot of questions about your income. They're going to ask you some other personal questions. They're going to ask you questions about your health. They're going to ask you just certain things. They're going to ask you, how do you want to pay for it? And so to have somebody just kind of help you, assist you through that process, can make it much easier for the individual.
Yeah. That's a great point. I mean, a lot of folks that are tuned in here, they're garment decorators. We make T-shirts, we make
Right.
tumblers and mugs. We're not insurance agents,
Right.
and I think all too often we try to be that, and it ends up being a terrible experience, or really not a quality experience, in the fact that we probably aren't getting what we need. And so working with somebody like yourself is I think can
just another set of eyes and ears on
Yep.
the process. That's basically it. There's no additional difference in the rate or anything like that. You're getting somebody who's got some feel for what this is all about, and as you know, from a personal standpoint, we have to get certified to work on the Affordable Care Act and the marketplace and everything. Each year we have to go through training and testing, et cetera, to stay on top of it. Not all agents do that. Some have said, hey, I'm out of it. I don't want to have anything to do with these programs. That's fine. But there's some that do, and you can go out there and figure out who those are and access them and use them. One other thing I do want to bring up, Aaron, is important, and I get this question asked quite a bit, is, well, Scott, I haven't had insurance for 6 months now, and now I just want to go out and buy insurance on the marketplace.
Yeah.
Well, you can't. Let me explain why.
Okay.
There's certain times during the course of the calendar year in which you can purchase an individual ACA health insurance program. One is during what they call the open enrollment period. Open enrollment runs from November 1 through December 15th each calendar year for the upcoming January 1. So November 1 of 2021 to December 15 of 2021 for January 1, 2022 effective date for your coverage. The other time is if you have a qualifying event. What's a qualifying event? Qualifying event can be things such as marriage, divorce, move to a new state, loss of employer coverage. And that's a key one. A lot of people call and say, hey, Scott, I'm losing my employer coverage. I'm retiring, or I've just been terminated, or I'm quitting voluntarily. Can I get an individual plan? Yes, you can. Okay, but you got to do it within a certain period of time. You got to do it within a certain period of time before that time reaches expires. When you come off of COBRA, you can also purchase. COBRA is the extension of the federal law. That's an extension of the group health insurance program that allows you to then purchase coverage as well. That's loss of employer coverage, allows you to get an individual plan. So there's certain times of the year you can get it. Other times it's, because I've had many people call me over the years, say, hey, Scott, middle of the year, and they say, hey, I've never had coverage. Now I think I need to go get coverage. Well, you can't. Now, there's a caveat to that, Aaron, and I wouldn't be saying this unless we were talking during this time from February 15th of 2021 to May 15th of 2021. President Biden, a few months ago, right after he took office, said from February 15th to May 15th of this year, there's a special open enrollment period. So if somebody doesn't have coverage right now and they don't have one of those qualifying events and they want to get insurance, now's the time to do it. This has never happened in the 11 years of the Affordable Care Act. This is a special one-time thing. And I've had probably half dozen people call me and say, Scott, I need to get it. Can I get it now? Yes, you can. Let's go.
Yeah, that's great. So you said until May 15th.
May 15th, and that would be for a June 1st effective date. So depending on when you apply it's the next upcoming month is when it's effective. All these plans are calendar year plans. So your plan runs until December 31 of 2021, and then you either re-up, maybe make an adjustment to your plan design, or change insurance carriers if you want to. All these plans are always calendar year plans.
Gotcha. Excellent. Okay. So we've got a question coming in here. Todd asks, what kind of information should you have easily available when you're looking for insurance?
Well, if we're looking just to find out the base rate for an individual, there really isn't much information needed. I could care less about your health conditions. It doesn't matter whatsoever if you're on 18 prescriptions or are pregnant or have cancer or whatever. Doesn't matter because it's guaranteed issue under these ACA compliant plans. What we do need to know is your date of birth, where do you live, what's your zip code, and are you a smoker? Because there are differences between tobacco and non-tobacco rates. Those are really the three things that we need to have in order to obtain a rate. Now, what I do is I drill down further and say, okay, because I think the most important thing is who's your doctor?
Yeah.
Who do you go to? Who are your key doctors that you have to maintain a relationship with? Some people say, Scott, don't have one, don't care, put me anywhere. Fine, that's it. I have others who say, oh no, I've got this one primary care and I've got this endocrinologist or this urologist or whatever the case might be. I really need to make sure that doctor is in my network. And so we'll go back to those 4 insurance carriers, figure out where is that doctor located. In some cases, they're in multiple. Sometimes, quite frankly, Aaron, these doctors aren't in any of the 4 insurance programs. And that's a dilemma for the individual. Then they got to decide, oh, you mean I've got to change doctors? Yeah, you may have to.
Okay. All right.
So just be aware of that.
Yeah. Now, are there then alternatives outside of the ACA program, and what? And if so, what's the difference?
Yes, no. How's that?
Okay.
People, I've gotten the question all the time, Scott, I don't want to get into Obamacare. I don't want to get into the exchange. I want to deal with the market. I don't want to deal with any of that stuff. I just want an insurance program. Well, there are none. That's our health insurance. If you want a long-term health insurance program, that's it, unless you want to go in a little bit different direction, which is not a guaranteed issue program. And that's a short-term medical program. And a short-term medical program, and then there's different insurance carriers that offer these. United Healthcare, Golden Rule put together a real nice program, but there are other insurance carriers as well that say we'll provide an insurance program for you, the individual, but you have to make sure you're well. You're not you don't have any of those issues. You're not pregnant. You haven't had cancer. You know. You may have slight high blood pressure, but that's it. Everything else, you can't. You got to be in really good health, and so those programs are out there. In the state of Missouri, those can run up to. You can get a program for up to 6 months, but then you have to re-up. So if your health changes during the year, you may be out of luck because remember, at the end of the 6 months, if it's during the calendar year, you're not able to go out there and buy an ACA plan because it's not a qualifying event. So I always warn people, there's pros and cons with whichever direction you want to go. There may be options. And I do have a lot of people who will take that risk. They say, hey, Scott, I'm in really good health. I'm going to go on that short-term medical policy because number one, it's a better network. It's all hospitals and doctors basically through United Healthcare. Number two, I'm in good health. Number three, cost is much less. And number four, I don't qualify for any type of assistance under the marketplace healthcare.gov. So this is a much better situation for me. I said, yeah, it is. It is. And now some of these programs are actually, you can get into them for a 3-year commitment. The state of Missouri is allowing that with some of the insurance carriers to provide up to 3 years now. That's all changing in the last 6 months. So there's some new programs coming along. I don't know how long that's going to last now, but we'll see how that plays out. So there are some twists and turns for some people who maybe don't want to get into the ACA compliant plans, but there's definitely nuances, and it's not for everyone. It just isn't.
Yeah. No, that's great. That's really great information, Scott. Thank you so much for sharing that. Now, Scott, I know we already kind of talked about this a little bit, but let's just clarify. Jerry has a question here that says, are pre-existing conditions an issue? And just kind of give us that pitch one more time there.
No, under the individual plans for the Affordable Care Act. So the ones that we've kind of basically been talking about here under the marketplace healthcare.gov. No, pre-existing conditions are not an issue. I mean, I've written policies on individuals who are 6 months pregnant, who are going through cancer treatment, who have diabetes. Not an issue. Come one, come all.
Yeah.
Well, that again, going back to the history of the Affordable Care Act, the individual part of it,
Yep.
That a lot of insurance carriers said, thanks, but no thanks. We don't want to entertain that risk because we don't know what that risk is.
Yeah.
Because before they were able to kind of dictate who they could insure. They looked at the health questions, and it was an issue. I remember having to turn down people for health insurance, not me personally, but I mean, as the agent, I would say, hey, you're declined. And it's, in some cases, it was devastating. Quite frankly, there were sometimes I couldn't understand why the insurance carrier was turning them down, because it was like, But now for the last 11 years, under this law and under this mandate, is that the insurance carrier has to take one, take all.
No, that's great. Okay, good. Thank you for clarifying that. So Wendy asks, if as an employer we don't offer insurance, but our employees get insurance on the exchange, can we give them a stipend for that?
Well, that's an awesome question, because this has really changed since January 1, 2020. So let's say I'm an employer out there and I've got 4 or 5 employees.
Okay.
And you're like, boy, I don't know if I want to put together a group health insurance plan. And I'll talk about that in a little bit if I could, Aaron, because there's really some nuances. Group programs are totally different than what I've just been talking about for the last 20 minutes with the individual plans.
Gotcha.
But let's say I'm an employer and I haven't put together a group health plan, but I've got these individuals, and maybe they've got spousal coverage, maybe they've got their own individual plan through the ACA. Maybe they don't even have health insurance. There's still people out there who don't have health insurance. So the employer says, what can I do to assist? Well, for a number of years, what a lot of employers were doing was saying, listen, I'll give you a stipend, I'll give you money, I'll up your salary, your hourly rate, whatever it might be. I'm going to just use the example, $250 a month. I'll give you an extra $250. You go do your own thing. It's all good. The issue is that $250 is taxable income to the employee. All right. So January 1, 2020, a new program came out called the ICHRA, Individual Coverage Health Reimbursement Arrangement. It allowed for an employer to provide a stipend, to provide money to an employee for their health insurance program and not get taxed on it. It's a program that's got to be set up through your accountant. It's very, very simple, very basic. But that $250 then is no longer taxable income to the employee, and it's also not to the employer. So it's a win-win situation on this thing for both parties and everything. So I would strongly encourage an employer who's got maybe just a handful of employees, or maybe just one, or they want to help out, they want to do something. Again, to try to attract and retain an employee, good employees. I want to help them. What can I do? That's the vehicle. ICHRA, get with your accountant, and they should be able to get that set up. But sometimes it could also be set up through your payroll company if you do use a payroll firm.
Okay.
But that's something that came out January 1, 2020. So it's only been out for a little bit. And I would strongly encourage a small business owner to look into that if they haven't established a group health plan up to this point.
That's awesome. That's a great tip there, Scott. Thank you so much for sharing that. All right. Got a few more questions coming in here if that's good. But you know what? Let's do this first, Scott, if you don't mind. You had mentioned talking a little bit different about the group plan. So why don't we cover that first, and then I'll come back to some of the questions that we got here, because we may cover some of these things.
Okay.
So let's share what you thought there.
So a small group plan, a lot of times I'll get phone calls and say, hey, Scott, I got 6, 7 employees. I never had a group plan in place before. What do I do? Well, there's certain nuances that have to be met in order to offer a group health plan. And sometimes it can be daunting for the employer, quite frankly. The role of the agent is to help that individual business owner through that process, because it is a process to go from not having anything to having a program set up. And that's kind of the hardest part, getting this thing set up. Once it's set up, it really kind of runs itself for the most part. There's still going to be claim issues or things like that. But for the most part, the hardest part is that 3, 5, 6 weeks of getting this thing set up. First thing is, the employer needs to recognize the fact that if they do offer a group health plan, they're going to have to contribute to that employee's premium. What's that mean? That means that I'll just use an example. Let's say the monthly premium, health insurance rate means the same thing. Let's say it's $500 a month. I'll just use that as an example. It could be 300, whatever. I'll just use 500.
Okay.
Easier math for me. The minimum requirement that employer needs to pay toward that is 50%, 50. So $250 per month for that employee's coverage. Now that is a business expense. And I remind people of that, employers of that, because though it's still a lot of money, it is a business expense from a tax standpoint.
Yeah.
But that's a big thing. It's like, oh my goodness, I wasn't doing anything. Now I'm paying. Okay, what are we doing here? That's the minimum. Quite frankly, the insurance carrier would like to have it higher. The average is about 75% for a business to pay toward the employee's premium. Now, I mentioned the term employee because in a lot of cases, you've got an employee, then you've got a spouse, and you've got children. So it's not 50% of that family unit. It's 50% of the employee's rate. So if the employee's family unit, let's say total is $1,500 per month, the employee's portion is $500, you're paying 50% of the $500.
Gotcha. Okay. That makes sense.
Can an employer pay more? Can the employer pay toward the dependents and the spouse? Absolutely.
Okay.
And it does happen. Not in the majority of the cases, but it does happen.
Yeah.
Some employers say, listen, I'm just paying 50% across the board. I don't care if you're single, have a wife, have 12 kids, whatever. I'm paying 50%, whatever your rate is, and that's the way it's going to be. So that's up to the employer, totally up to the employer. The next biggest thing when we get into establishing a group plan is that we need to make sure we have enough people participating. In other words, if you've got 8 employees and we're going to need a certain percentage of those employees to participate in the program, and those percentages get all goofy depending on the insurance carrier, depending on if they're waiving coverage, depending if they have credible coverage. I won't get into down that rabbit hole today because my head starts to spin with some of these things. And quite frankly, I had to keep going back to the insurance carrier and saying, now, how's that work again with this particular one? Like we need to get a certain number of employees participating in the program in order for it to be established. Okay, so that's a key thing. So we got those two things going on. Then it's just a matter of getting a census, which is a listing of all the employees, where they live, what are their kids, spouse information, date of birth, and everything. And then we go out to the insurance carriers. In the St. Louis marketplace, there's a couple different ways to do it. You can get just the regular fully insured programs. There in essence are just a couple of insurance carriers in St. Louis that offer that, Anthem Blue Cross and United Healthcare. Quite frankly, United Healthcare has been the most competitive for small businesses over the last few years. But you have 2 insurance carriers, and they have various plans. One of the nice things about a group plan, which is totally different than an individual plan, is that now we have access to all the hospitals and doctors. Remember I was talking about those defined networks for individuals? Yeah. That's the really upside about these group plans is that you can get access now to the wide variety of PPO networks that those 2 insurance carriers offer for those regular programs. And those are guaranteed issue programs. So again, don't care about your health conditions. That doesn't matter. Set plans, set rates, as long as you meet the criteria of the contribution and participation, boom, you're up and going. Programs starting the first of the month. Usually takes I always tell people it takes about 4 to 6 weeks to kind of get this process going and everything before you get set up. I establish a number of small group plans for businesses each year. And again, probably the biggest reason is because the business owner wants to put a program in place to attract and retain good employees. And this is a great way to do it. But there's a process and there's a cost associated with it to make that happen. Yeah.
So Scott, I know, like you said, the percentages and how they figure all that out but is there like a minimum number of employees that you have to have? I mean, what if you just have 1 or 2 employees?
Great question. 2 is, I'm going to use 2 with caveats depending on different programs. But in essence, there needs to be at least 2 employees. And in general, it cannot be a husband-wife. Because I get that question asked a lot. Hey, my wife and I are in business together. Can we just do a group plan as opposed to doing these individual plans? Yeah. And in general, no. Now, there are programs of which have recently come out in the last couple of years, one of which is through the Chamber of Commerce. The state of Missouri and the Missouri Chamber of Commerce has a program, and I've put a number of businesses in these programs. Those programs work differently than the programs I was just talking about. The Missouri Chamber programs are not guaranteed issue. You've got to be in good health, but they do have some caveats as far as who they will accept and how those how small the business can be as far as number of employees and how that all kind of plays out and everything.
Okay.
But the other thing is you have to be a member of the Chamber of Commerce.
Yeah, sure.
Of the Chamber of Commerce, and to participate, and there's some charges along with it and everything. But that is another option for a small business owner, the Chamber of Commerce program, and it could be a really nice program for a business. It can be a very good program because in a lot of cases those rates are better than what those ACA programs are, and you got full network, and it can be a very nice, but it's not for everybody.
Yeah. Yeah.
So that is a possibility for small business owners, and I would encourage them to talk with an agent who has access to those programs, and I do have access to those programs. That was part of my reasoning for my merger from my agency to DeWitt Insurance, is that it gave me an opportunity to become part of a organization called the Blue Chip Consortium, which is a very large employer benefits organization here in town that has access to a lot of these programs that really have helped for small business owners.
That's great. That's fantastic. So, Scott, you talk about the Chamber of Commerce. In fact, Todd kind of asked this question a little bit, but I'll could a industry organization put together a group plan then? I mean, is that
it? Yes.
How does that work?
Yes. No, it's not as simple as it may sound.
Okay.
I mean, it took years for the Chamber of Commerce to get this thing together. It's been out there now for a couple of years. There's a lot of issues when it comes to what they call multiple employer programs.
Yeah.
MIWAs is the acronym for. There's a lot of acronyms in this insurance world, and my head spins sometimes from trying to keep them all. But it's not as easy as it sounds. But yes, but you've got to have a really strong organization. A lot of them in years past have failed, because sometimes what happens is there's some nuances with it. I'll just leave it at that. It's not as easy as it sounds to establish something. It just isn't.
Okay. Yeah, that's kind of what I figured. We inside of our industry, and I'm involved with different organizations and stuff like that. And we actually talked about that at one point. Like, can we put together something to help the small businesses in our industry? And yeah, kind of ran into that it a bit more than that you to chew on than just kind of going, hey, let's do this kind of thing.
They used to be prevalent 20 years ago when I was that was back when I was at least 20, 25 years. Like, the printing industry in St. Louis had a health insurance program called Pistol, the printing industry of St. Louis, and but it went through a number of changes, and it's just difficult to put a program together. Especially now when you have a guaranteed issue product out there under the Affordable Care Act, because that's really the reason why a lot of associations were formed, is because they couldn't get coverage on their own, so they needed to try to form a group. So anyway, there's again, that's for a whole nother discussion, quite frankly.
Yeah, totally. I appreciate you sharing what you shared there. Okay, so Wendy's got another question for us here. She asks, on the group plan for employee participation required rates, do owners and principal members go towards that percentage or rate?
Well, the owners, I always encourage the owners to participate in their group health plan. Do they have to? No, but it's nice to have ownership involved with the ownership of this group plan. But do they have to? No. So again, let's say you've got 8 employees, 4 of them to say, yeah, I want to participate in this program, and 4 of them say, no, I don't want to, because I've got other coverage elsewhere. You're going to be able to write that group plan. We're going to be able to establish that group plan. Yeah, and put it in place. The rates for these groups, and again, I'm not talking about the chamber plan. I'm just talking about the small group ACA plans.
Yep, definitely.
The small group ACA plans, your rates are going to be based on the person's age, and where they live. So, and every age has a different rate. It doesn't even matter male or female. It's gender neutral. It's just what's your age, what's your date of birth, and that's what your rate is going to be. And then you have your spouse, and then you have your, let's say, 2 kids.
Yep.
They're 13 and 11. They've got their rate. You add those rates up. That's what your premium is for that particular plan design. In the small group world, these insurance carriers, as I mentioned, United Healthcare and Anthem Blue Cross, they've got anywhere from 15 to 30 different plan designs to choose from, with varying degrees of deductibles and prescription programs and so on and so forth. So there's a lot of flexibility in the small group plans, much more so than there is under the on the individual plans.
Yeah, that's great. That's great. That's appreciate you explaining that to us. All right, one more question here, Scott, and I'll let you get back to your Saturday here. Wendy asks, can you explain health savings accounts? Is this only for owners, or can employees participate?
That's an awesome question. We haven't even talked about a health savings account, and I love health savings accounts.
Okay, good.
Again, this could be for a whole nother topic and a whole other Saturday, quite frankly, Aaron, because health savings account, they came to be not quite about 20 years ago. And what it is, a health savings account program, there's 2 components to it. You've got your qualified high deductible health plan, and then you've got your savings account. The main function behind an HSA program is to make the member a better consumer of healthcare, and to provide a tax deductibility program for them to put their money into to pay for their medical expenses. Now, what do I mean by that? What I mean by that is, under a health savings account program, as I mentioned, the health insurance portion is one, and that's, could be written by United Healthcare or Anthem Blue Cross, whomever.
Yep.
You've got a high deductible plan. The way I always tell people to look at it is this: you have no coverage until you hit your deductible, except for preventive care, which is covered at 100%. Okay. So you go in for your mammograms or your colonoscopies, or you're just a well woman exam or a physical, that's covered at 100%. Other than that, you have no coverage to hit your deductible. And your deductible could be, let's say, $3,000. Okay. Your deductible. So you're responsible for everything. Mm-hmm. So being a better consumer. So now when you go to Walgreens to get your prescription, instead of having your $10 or $15 or $25 copay for your generic or brand name prescription, you may have to pay $72.50 for that.
Yeah.
So where's that $72.50 coming from? Well, it's coming from your pocket and hopefully your savings account. Because remember, there's 2 parts of your HSA plan: medical insurance, and then your savings account. Because what you've been doing along the way is you've been putting money into the savings account. That money that you're putting into it is tax deductible. It comes off the top of your taxes. Okay. So then you have your debit card. Literally, it is. I personally participate in an HSA. I love them. Are they for everybody? No. You need to understand how they work, but they can be great. You take your debit card, and then they swipe that, and so that money comes out of your HSA account, your savings account, and there's no tax issue or anything like that. You're not taxed on them or anything like that. So it's a benefit to you from a standpoint of you're putting money into a savings account, which is tax deductible, and it's making you a better consumer. Why is that? Because next time you go to Walgreens, you may say, wait a minute, I'm getting this thing here for $72.50, but over at CVS, it's $49, or at Schnucks, it's this, or at Walmart, it's this. I think that's where I'm going to go get my prescription because it's coming out of my pocket, and now I'm responsible for it. So you're making you a better consumer. So specifically to her question, can employers and employees participate? Yes. If an employer establishes an HSA program for their employees, and I have that happen quite a bit, the employer can contribute, the employee can contribute, or a combination of both. If the employer doesn't want to, they don't have to. And if just the employee wants to, they can, or vice versa. Keep in mind, whatever monies that are put into the employee's HSA savings account is the employee's money. If an employee were to leave employ, that money goes with them.
Okay.
The employer does not get that money back.
Gotcha.
But it's a nice incentive for the employer to the employees. So listen, I'll just make up $100 a month. I'm going to put into your savings account, and that's good. But you have to match it. I'll just use it. A lot of people say you have to match whatever I put up to a
Yep.
certain number. And that way that gets people thinking, okay, yeah, I'm going to do this. And it really can be a nice program for an employer and employee, but it is different than your regular PPO plan where you've got your first dollar coverage. It was kind of a long-winded issue regarding HSA, but again, you could talk forever about these programs because there's a lot of intricacies to it, but they're really. I was involved with a seminar about 10 days or so ago, and the presenter said that there are over 31 million HSA accounts now in the United States. So they've really taken off, and I can see that continuing.
Good. Awesome. Well, thank you so much for sharing that. Scott, I said that would be the last, but I just noticed that I missed one up here. So if you don't mind hitting this real quick, and I know you kind of briefly talked about this, so maybe just share again. Sandy asked, what about catastrophic only coverage? You said that was the kind of typically a bronze plan.
Yeah, it is. That's the way I look at it. The bronze plans within the ACA individual marketplace are going to be your catastrophic plans. Why do I call it that? Because there's not a whole lot of coverage before you get to those deductibles. There may be some primary care physician copays. There may be some 50% off your retail prescription coverages. There may be some other nuances, but in essence, your deductibles, $6,000, $7,000, $7,500 are out there. Are those the lowest price plans? Yes, they are, and they are for that reason. There's not much coverage until you hit your deductible. Now, for some people, perfect. That's all they want. They say, "Listen, Scott, I never get sick. I'm fine. I just want to make sure that I've got something just in case catastrophe does hit and something happens, like cancer, whatever the case might be."
Yep.
Keep in mind the main number there is that maximum out of pocket, because even those bronze plans have your maximum out of pocket at $8,000 or $8,500, whatever that number is. Each year it ratchets it up a little bit, but you're going to be the same as you are in a silver or a gold plan, and the like. Aaron, if I could mention one thing that did just come up in the back of my brain regarding these individual plans, I wanted to make sure.
Yeah.
When the ACA program came out, there was a mandate that individuals had to have some type of health insurance coverage, either a group plan or an individual plan.
Yep.
There was a penalty that you would have to pay, a tax that you would have to pay each year if you did not participate. Okay, that went away a couple of years ago. So, quite frankly, an individual does not have to have an individual health insurance program if they don't want to. That's as we speak today.
Yeah, sure.
That may change back
to
the current administration. I don't know. But under the past administration, they said, we're going to take away that you're not going to get charged if you don't have that that insurance and everything. So that kind of opened it up to these other short-term medical programs being available, medically underwritten, all that kind of stuff. So that ties into this whole thing regarding what. Now, having said that, most people still want health insurance.
Absolutely.
They understand if they don't have it, what could potentially happen to them and or their family.
Yeah. And thank you for sharing that. I actually did not know that. I still, I guess, just assume that was there. Again, want to have health insurance for me and my family. So it wasn't really a question, but yeah, I had known people that said, okay, well, now I have to get insurance. And, great. Thank you so much for that. All right. Well, Wendy asks, how do we get in touch with Scott? And we've got that. Let me get that up on the screen here. But Scott, so I'll also share this into the comments after we get done, so people have all your contact details. But it's streams, STREAMS at DeWittInsurance.com is your email address. And then you were kind enough to share your cell phone number with us as well. We appreciate that. 314-440-3525. And actually, you could also catch Scott in his office. Now, congratulations for being able to be back.
Oh, yeah.
Not everybody's back yet, good for you. Yep. 314-966-6300, extension 217. And again, we'll get all that shared. Scott, anything else that you want to leave folks with? What's new and good with you? And yeah, just to close us out here.
No, that's we've touched on a number of things. I guess the one thing that I want to stress for the listeners is that there isn't a simple template that fits everybody's needs. Everybody's a little bit different of where they are, what they're trying to do, the workplace that they're involved with, the industry they're involved with, the needs that they're looking for, their employees, themselves, whatever. And so it is important to talk to somebody, another set of eyes and ears on this, and just kind of walk through it and find out what might be. Is a high deductible health savings account program best for your employees? Do you just need a catastrophic plan? Should you get a first dollar coverage plan? Do you mind if you have a program that has a defined network where you don't get the chance to go to all the different hospitals and doctors in town? Just be aware of all of that. And then once you have something in place, you realize the hardest part is getting it in place. And then once it's in place, then you're able to navigate throughout the year pretty well.
That's awesome. Yep. That's a great point. And I know you will be hearing from my wife and I. So we kind of took on one of those catastrophic coverage situations, and we want to make sure that we've got it right. And so we're excited to talk to you, and thank you so much for your time today, Scott.
Oh, you're welcome. Thank you. Have a good day.
You as well, Scott. Thanks. Awesome. Well, that was fantastic talking to Scott. Wendy said outstanding Small Business Saturdays. So we appreciate Scott and his time, again, getting up with us here early on a Saturday morning and joining us and giving us all of that wonderful information that helps us navigate that. It is a tricky situation. It could be a big question mark. And so Scott did a fantastic job kind of giving us the points and the things we need to think about, the information that we need. And I totally agree with him. We're going to do the same thing. We're going to reach out to Scott as he's here in our area of St. Louis. And as Scott mentioned, he can probably help point you in the right direction too. But find somebody that you can work with in this is probably my biggest takeaway from the whole thing. Obviously, massive amounts of great information in there, but at the end of the day, it's not your business. You can tell somebody like Scott has that passion for what he's doing. And so let's work with people that have the passion for that. And we'll continue to have the passion for what we do in creating awesome garments and all that kind of fun stuff. So that's my kind of close on this today here, guys. Unless you guys have anything further, I think we'll go on and get off to our Saturdays as well. And have not quite wrapped my arms all the way around next week's program yet, but got some more fun stuff coming up that we can talk about. So if there's anything you guys would like to hear, like to learn, like to understand better, that we can explore on a Small Business Saturday, please reach out. You guys obviously know how to get in touch with me. Post it in the private members group there, and we'll get it figured out from there. But without further ado, you guys have a great rest of your weekend, and we will talk to you guys next week.